So a diagnosis of prostate cancer can be very scary for patients. I think the important thing to take away from a diagnosis of cancer, particularly prostate cancer, is that it is a highly curable cancer, and there are a lot of treatment options.
I felt like in this process, once I found out that I have prostate cancer, and once somebody said, "You've got it, it's significant cancer," then I really had a couple choices. One was remove my prostate, which is get rid of it, right? And that carries with it some implications, right? Long-term implications, although then your cancer is gone. Or with brachytherapy, which is what I ended up doing, how about we go into the prostate, zap it with radiations, seeds, and needles, and have it be treated long-term and have your symptoms go down and your PSA numbers go down, and pretty soon, a cure is going to be there. To me, having my prostate and being able to perform like I'm used to performing instead of removal was a much better option. And when I found out I was a candidate for that, it was a no-brainer.
Prostate brachytherapy, as compared to external beam radiation or surgery, has several advantages in certain patient subsets. So, number one, it's a one-day outpatient treatment.
It's typically outpatient. It's often done under anesthesia of some variety. We do it under general anesthesia for the maximum comfort of patients. The procedure takes about an hour and a half to 2 hours, so it's a relatively short procedure, and it's relatively low risk because there's no cutting involved. We place seeds into the prostate through needles that go through the skin. So it's really a minimally invasive treatment for prostate cancer.
Following treatment, you want to get back to your normal daily activities as quickly as possible. And as opposed to surgery, where you might be in the hospital for several days, you might have to have a catheter to facilitate urination for several weeks. Brachytherapy, once you wake up and you leave, you're back to your normal daily activity virtually immediately. That is one of the really acute and important features that separate brachytherapy versus a surgical alternative.
So when we see men for the discussion of options of prostate cancer, we always talk about side effects, and the side effects have to do what's in the area. So the side effects may be urinary dysfunction, it may be bowel issues, it may be sexual dysfunction, and that's the focus of the consultation, and then also comparing them to other things like surgery or external beam radiotherapy or SBRT. So what we know with all radiation is men have acute urinary symptoms that generally go away after a couple months. The most common side effect that we can cause and all intervention can cause is erectile dysfunction. And just a close relationship with your doctor is how you go about mitigating that side effects and getting back to normal.
With brachytherapy, I typically put patients on medication that allows them to not only sustain their erections, but continue to have their erections right after their treatment so that they can sustain that ability to have sexual functions. And then there's many that don't even take any medication and do very well and maintain their ability for sexual function right after.
It has some of the highest rates of sexual function preservation and also some of the lowest side effects with regards to bowel and bladder side effects as well.
We know all men, no matter what the radiation they get, are going to have urinary bother up front, but it usually goes away after a couple months.
With surgery, you typically leak and have some incontinence, which requires you to wear daily pads or some type of protection. In brachytherapy, we do not see incontinence where patients are having to wear protection to do their daily activities. Even the fun activities, like going and swinging a golf club or working out, those can also cause you to leak urine when right after you've had surgery, and that can extend for periods of time, for months, and for some patients, years. In brachytherapy, we don't see that.
So prostate seed brachytherapy is a treatment that's been around for quite a number of years. It has long-term results that show excellent cure rates and low toxicity.
It's been going on, and the modern technique started in Seattle in the 1980s with myself and two other doctors, but with ultrasound guidance, hundreds of thousands of patients have been treated.
When you're comparing to surgery or external beam radiation, we have over 20 years of outcome data that show it is an effective treatment strategy with very minimal side effects, incredible organ sparing to the bladder and the rectum, but most importantly, the cure rates are comparable and better in many cases on head-to-head comparisons.
A lot of people think that surgery should be the best because you take the prostate out, the cancer's gone, but they don't realize that in many patients there's microscopic cancer outside the prostate, and why surgery takes out the prostate, it didn't get all the cancer out. The goal is to get rid of all the cancer. So brachytherapy treats the prostate and outside the prostate. External beam radiation is good at treating outside the prostate, but the dose is limited because the beam has to go through normal tissue to get to the prostate, and normal tissue can only tolerate so much radiation. So the seeds are put right in the prostate and treat the prostate, and a small margin, about 1/4 inch around the sides of the prostate to kill that microscopic disease. Surgery misses. The dose is higher, though it can kill the cancer inside the prostate the radiation beam misses.
Outcome surveys looking at patients that have had surgery versus brachytherapy, and we've published that data from our institution. And what that data has demonstrated is that there is better sexual function for those that have had brachytherapy. There's less incontinence and leaking of urine for those that have brachytherapy, and that the overall patient satisfaction is higher following brachytherapy. This is a great and ideal treatment for those patients.
If you're a candidate for brachytherapy, do it. If you're a candidate. Not everybody is. But if somebody said you're a good candidate for this, just do it. Because I think for some people that ship has sailed, and maybe it's not. But when I found out, when I heard the words, you are a candidate for this, I go, done. Done. And so if you are, just do it. If you're not, seek all the information that you can. I guess I was lucky.